The colder weather usually brings concern over the flu, but this year a new virus has emerged. FYI's Lisa Sugart has more.
We've heard it in the news quite often lately, enterovirus. And many of you out there are wondering, what is it and is it in our area? To get those answers, we are here at Lehigh Valley Hospital, Hazleton, to talk with Dr. Steve Glicken, who is the chair of pediatrics. Dr. Glicken, I guess, first of all, tell us what enterovirus is.
Okay, enterovirus is a large family of viruses, and it includes a number of smaller families like the Coxsackie viruses, the echoviruses, and there's also a subgroup called enteroviruses. Among them is poliovirus, which is not related to the current infections we're seeing.
Okay. Now, we've heard, that it can be fatal, that children have died from it. I'm a parent. Should parents be worried?
I would say that they shouldn't. You have to put this in perspective. At the current time, about 8 or 10 children have died in the United States, and considering that we're a nation of over 300 million people, that's one death in 30 million. There are other things that are far more deadly, like influenza, and even accidental injuries like gunshot kills many hundreds of times more children than enterovirus.
Have we seen or have you seen enterovirus here in the Hazleton area?
I'm sure that we have. The current laboratory testing that we have will only tell us if we have something in that family, but does not tell us specifically if it's the type 68. But we've had children with the typical symptoms of moderate to severe respiratory infection with wheezing, and I have had one child who I'm suspicious about who has weakness of one arm and leg, and this may be an effect of enterovirus also.
We've been hearing that there is some paralysis they think possibly associated with this. So that's what you're talking about then?
Yes, I am. It's rare, but it happens, and there are other viruses that do it too. So we're checking for all the viruses.
For a parent who may be watching this, what should they pay attention to? Should they be aware of certain symptoms? Is immediate attention by a physician crucial?
Immediate attention is not all that crucial. Partly because most cases are mild and partly because there is no specific treatment. But particularly children who have asthma may have significant respiratory difficulty and a big increase in their wheezing. And if that happens currently in the presence of fever, we should check it out because there's a lot we can do to make them comfortable.
So what exactly are all the symptoms associated with it, and do all patients have all the symptoms?
No, all patients don't have all the symptoms. Most children who catch it are just going to get a bad cold with or without a fever, and then in the majority of cases we won't know that it's enterovirus because we won't test for it. Some children will have significant difficulty with their oxygen levels and significant wheezing, and in those children we are testing for the virus, although that's mainly to know what's in the community and doesn't change the treatment that we offer. A few children will develop GI symptoms, diarrhea and or vomiting, and very rarely there are cases of encephalitis, which is like meningitis, and that usually gets completely better. And there are a few who develop disease in the nerves supplying the muscles of arms or legs. That's quite rare, but needs attention, and they may require physical therapy to help them recover.
Well, one final question. Is there anything we can do to stop the spread? Like, is hand washing important?
Hand washing is always critical with most respiratory infections. People think that it spreads when you sneeze or cough through the tiny droplets, but the hands are a much more effective way to spread all of these illnesses. So everyone in the house should wash their hands if there's anyone ill, and try to avoid touching people who are sick, and don't touch your own face without washing your hands.
All right. Some very important advice. Hopefully we've calmed your fears and let you understand this enterovirus a little bit better.